Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, what do you get when the leading architect of the Affordable Care Act dials up the law's number one opponent? Would you believe a health policy idea with bipartisan appeal? Liz Fowler is a Johns Hopkins faculty member and former counsel to the Senate Finance Committee. Michael Cannon is director of health policy studies at the Cato Institute. The unlikely pair talked to Dr. Josh Sharfstein about their recent Washington Post op-ed calling for an end to the tax subsidy for employer-sponsored health insurance. Let's listen.
Michael Cannon, Liz Fowler, thank you so much to you both for joining me today at Public Health on Call to talk about this interesting policy idea that you have proposed together in the Washington Post. I have to say, though, that it was kind of surprising to see you both on the same byline, and I think we should start by explaining why that's the case. Would it be fair to say that you were on different sides of the debate on the Affordable Care Act? Would that be?
Yes, very fair.
Yeah. Michael, what was your view of the Affordable Care Act?
So I opposed the Patient Protection and Affordable Care Act when we called it Romney Care, and then when it appeared at Congress. And after Congress enacted it, I have been trying for years and years to repeal it and still favor repeal.
And Dr. Fowler, tell me about your experience with the Affordable Care Act.
Yeah, thanks, Josh, and thanks for the opportunity to be here. I was the chief health counsel at the Senate Finance Committee and helped draft the Affordable Care Act. And then I went to the White House to work on implementing the act. So I am very in favor of it. I think, it's done a lot of work to help millions of people get health care. I know it's not perfect, but it is something that's really important to a lot of people around the country. And I do not think it should be repealed. So you're right. We have a lot of disagreement between the two of us.
For years and years, actively working at cross purposes, because Liz basically wrote the Affordable Care Act. I mean, there were other people involved, and then she went from the Senate Finance Committee to the White House, where she helped to implement that law.
And you've been criticizing it every step of the way, but that's not the purpose of this podcast. This podcast could be a 5-hour discussion of the Affordable Care Act, but we're going to go for the 15-minute discussion of what you agree on. And let's start with Liz. Could you explain how the idea for this op-ed started?
Yeah, I can, because I was the one that approached Michael about it. Let me just start by saying that this is an issue we tried to address in the Affordable Care Act. The issue is basically that right now, if you receive employer-sponsored health coverage, the value of that insurance coverage is not included in your income or payroll taxes. But I'm going to let Michael explain exactly how the tax policy works, because I think he's better at doing that, and then we can continue the conversation.
Sure. Michael, you get the call from Liz. How do you describe the issue, and what was your reaction?
So I think what is really telling about Liz's and my collaboration is we disagree about every aspect of Obamacare, but we agree that Obamacare is trying to solve a problem that Congress largely created, or a lot of problems that Congress largely itself created, with this weird tax break or tax preference for employer-sponsored health insurance. Economists have been complaining about that feature of the tax code for decades and decades, and how harmful it is. And I think that even today, economists don't really understand just how harmful that provision is. And it seems really weird to say, because this is a tax preference or a tax break, a tax exemption. People like not paying taxes. So not paying taxes on your employer-sponsored insurance, isn't that a good thing? Well, I like not paying taxes. I'd like to repeal the income tax. However, when you have the government saying that if your employer gives you cash, we're going to tax it. But if your employer gives you health insurance, we're not going to tax it. That creates a whole host of problems.
So you have a tax preference for health insurance, which essentially makes health insurance cheaper to buy. Liz, let me start with you. What's wrong with that?
So I think maybe my philosophical concern is Why does your health coverage have to depend on your employer? Why do you have to be working in order to get health care? This is a question that we asked when we were drafting the Affordable Care Act. What if you don't have a job that offers health coverage? Where can you go? And by the way, we're overly subsidizing that employer-sponsored coverage and under subsidizing other coverage. And then it turns out, the HR1 bill that passed last year that ties work requirements to Medicaid. Again, this issue comes up. Why do you have to be working in order to get health coverage? And I don't think you should have to. No other country in the world ties health coverage to employment status. And so I think that's the philosophical question that I think this issue raises. But it's also my word, not Michael's. I think it's a regressive approach to subsidizing health coverage because people who are at the higher end of the income scale are more likely to have employer-sponsored coverage, and then they also get a greater benefit because they have a higher marginal tax rate, and that also seems inequitable. This is the largest single expenditure in the U.S. tax code is employer-sponsored health coverage, that exclusion from income and payroll tax. It's bigger than the mortgage interest deduction. So it's really creating a lot of inefficiencies in our health system in ways that I think maybe we didn't intend when the policy was adopted, 75 years ago, Michael?
Maybe 100.
So, Michael, what's on your list for why you hate this tax benefit for employers?
So you mentioned that it reduces the price of employer-sponsored insurance, and that is true, but only at first pass. And over time, what it does is it increases the prices of insurance and medical care. So that's the second big problem that it creates. Ever since Kenneth Arrow wrote about it in 1963, economists have recognized that insurance increases prices because the doctor and the patient don't care as much about keeping prices down when the insurer is paying versus when the patient is paying. And so when Congress, through the tax code, says we're going to reduce the relative price of health insurance relative to other uses of your income, then people buy more health insurance. When people buy more health insurance, demand more health insurance from their employers, they face fewer prices when they are consuming medical care and pay a smaller share of the price of the medical care. And so they then demand more medical care. So they demand more health insurance, the price of health insurance goes up. They demand more medical care, so health insurance files more claims. That makes the price of health insurance go up further. And they care less about the prices of the medical care they're demanding because the insurance company is paying. That means the prices are going to be higher, and that increases health insurance premiums. So even though what you said was right on day one, that it reduces the relative after-tax price of health insurance, all of these effects combine to drive up the price of health insurance so that fewer people are able to afford it. It consumes a growing share of people's earnings. It contributes to wage inequality. And remember what I said initially, if you get an expensive condition and then lose your insurance, you end up with an uninsured and uninsurable pre-existing condition. That's when all of those excessive prices that this tax preference encourages hit you the hardest. So we strip you of your health insurance after you get sick, and we push you out into a market where the prices are higher than they need to be. Those are just a couple of the cruelties that this tax preference visits on workers, and Liz is absolutely right. Low-income workers suffer the most because they have less access to insurance in the first place, and then those high prices hit them hardest.
So you're proposing getting rid of this tax preference, and a part of me wonders if we can find a health policy idea that the primary architect of the Affordable Care Act and the primary critic of the Affordable Care Act agree on. How could there be opposition? Why has it been so hard to change this policy, Michael?
The graveyards in Washington, D.C. are full of proposals to reform this feature of the tax code. They ran into a buzzsaw of they always run into a buzzsaw of opposition from the people who benefit from this tax preference, primarily the healthcare and health insurance industries, and large employers who benefit because it gives them an advantage in the labor market over their smaller competitors. And what those beneficiaries of this policy are able to do is, even though this policy is incredibly harmful to workers and consumers, there are a lot of people in employer plans who are afraid of losing their coverage. And so opponents of reform will demagogue that fear. John McCain in 2000, when he was running for president, proposed to reform this feature of the tax code. And Barack Obama ran some of the most effective political ads ever, demagoguing the fears over people with high cost conditions that they would lose their coverage. McCain's policy advisor says he still has nightmares about those ads, though these many years later. And that is what happens every time you try to reform this feature of the tax code. But in our op-ed, Liz and I talk about combining one, really, you might call it a Democratic idea and one Republican idea. And putting those two ideas together, I think, could help you put together a bipartisan coalition that could overcome the opposition of the industry and large employers, in part by creating a constituency of identifiable beneficiaries from reform. I'm talking here about workers who would be able to control the $20,000 of their earnings that this provision of the tax code lets their employers control.
And how would that approach work, Liz?
Well, in my mind, I think if you took some of the funding that's currently used or spent or whatever the right word is for this tax subsidy and actually let employers choose to give workers a contribution and find coverage, I think now there's a place to go to purchase coverage, and that is the ACA marketplaces or the exchanges. I think one of the fears in the past was, if you didn't have employer-sponsored coverage, where would you get coverage? If you had the ability to choose your health coverage, maybe you would choose to stay in your employer coverage. But now there's a place to go where you could potentially get stable coverage, and that is through the marketplaces or the exchange plans.
So the idea is that instead of just returning all this money to the Treasury, some of it could be provided to workers in other forms that could help them get health insurance.
One of the obstacles to reform is that since this is a tax break, you want to make changes to it, people are going to say, hey, you're raising my taxes. I don't want that. And that's how the Treasury gets more money, is if you raise people's taxes. And so that's one approach to reforming what we call the tax exclusion for employer-sponsored health insurance. But that reform has failed. I mean, people have tried that. Obamacare tried that with what we call the Cadillac tax. And Congress later repealed that almost unanimously. So to thread this difficult political needle, I think what you need to do is make sure you're not increasing or net increasing taxes on anybody and creating benefits for people who will fight for the reform and fight to preserve it after it passes. And people talk about this provision of the tax code as a tax expenditure. And when they say, I don't like that term, but when they say that, they talk about $400 billion that Congress is spending. Not really. That's the revenue loss the static revenue loss to the federal government because this tax break is there. But there's a much bigger pot of money out there. That's total spending on employer-sponsored insurance. That money comes out of workers' earnings, but employers control directly about $1.2 trillion of that money. Again, that's the workers' earnings. And I think if you structure reform so that it gives that $1.2 trillion each year to the workers who earned it, and then lets them choose their health plan, be it they can stay in their employer plan or go to the individual market and buy maybe an Obamacare plan, maybe another one, then giving people that money, which is like $20,000 per family, I think is an identifiable benefit that can help assuage the concerns people will have about reform that they might lose their coverage and end up with nothing.
So everybody in the world of health policy reads the idea that you have put together. And how's it received?
You know, what's interesting is I think a lot of people agree that this is the right approach. I can't tell you how many messages I've received like, yes, we ought to do this. This makes a lot of sense. Publicly, are they going to say that? Is this something they're going to actively support and pursue? I'm not sure. But I think there is a lot of support, and I think you shouldn't underestimate how many people on both sides of the aisle think this is the right thing to do and the better policy.
Michael, what's been the reaction from your perspective?
It has been generally positive. And, what I've sketched out here is my way of operationalizing the principle that Liz and I laid out in the op-ed, where you take the one Democratic idea and the one Republican idea. And so, when you ask me, what has the reception been so far? I'm in the middle of selling Liz on my operationalization of this approach right now. And so I want to ask her, how am I doing so far? We're still discussing it and working it out, but I've sent the idea I've got lots of positive feedback on the op-ed from economists be they Republican or Democratic or Libertarian economists. They're all, the economists get this. This tax preference is terrible, but they all get that the politics is also really difficult, the politics of reform. And I have gotten a lot of positive feedback on the idea of, the approach of, using that $1.2 trillion as a political sweetener by giving it to the workers so that we could maybe thread that difficult political needle.
Got it. Last question. How have people reacted to the fact that you guys work together on this?
I think people at this point are surprised that there's any common ground between people on the other side of the aisle at all. And so I think people are in some ways pleasantly surprised that there is something that could get bipartisan support. That's not to say there are no ideas that get bipartisan support, but this is sort of a bigger picture idea and not something sort of more targeted. So I think people think that it offers some hope that maybe there's a path forward.
I think people are flabbergasted. I mean, because I had the New Republic call me Obamacare's single most relentless antagonist. And everyone knows that Liz Fowler helped to write the law. And so to see us on the same op-ed was really just astounding to people. But I think it speaks to Liz's professionalism and compassion that she recognizes this as a problem, recognizes that, hey, this is not like some partisan or even ideological thing. Michael agrees with me on this. We can make the world a better place if we work together on this. And so I thank her for that.
Well, you guys give me hope. Thanks to you both for writing this piece and for the conversation that it's inspired. Thanks for joining me in Public Health on Call.
Thank you.
Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.